This is Guardian Radio, your station for up-to-the-minute news and intelligent, interactive, and engaging conversations. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the views of the management and staff of Guardian Radio.
With early detection comes early prevention.
Put that in your pencil, make you feel like a champion.
Rise up again, let nothing keep you down. To live your best, hear the urologist speak. Oh yeah, oh yeah.
Think you're losing grip of your man, don't give up on hope.
Don't be ashamed, it's time to take control. Get some help from the urologist.
You will find
He'll help you solve your problems
on 96.9, yeah.
I telling you, with early detection
Comes early prevention.
Good evening, Bahamas. This is Bahamian Urologist Dr. Greggory Pinto, and it's my pleasure to have in the studio a Bahamian icon, a veteran radio host, Mr. Eddie Carter, who is a lifelong supporter of the Bahamian culture and music as a whole. It's a pleasure to have you. Good evening, Eddie.
It's good to be here, Dr. Greg. Good to see you this evening. Thanks for having me.
So we're just going to talk from your perspective as a man who's just a little bit beyond middle age, your experiences with...
Well, I gotta be beyond middle age now. I'm going to be 60. I don't think I live to be 120.
Okay.
All
right.
I plan on living forever, and I'm off to a good start, but I don't think it's going to work.
Let's aim for 120.
Okay.
So we're going to talk about your experiences with the inevitable. And what we're talking about today, basically the topic is can't stop peeing. We're talking to the men out there. We're talking about their urinary issues. And what we talk, the medical term is lower urinary tract symptoms, whether it's got to pee all the time, or obstructive, where you have a very weak flow, you can't initiate a flow, you have incomplete bladder emptying, you're dribbling, and
I'm shaking just from the memories you're giving me right now, okay?
So we wanted, and you're here on a voluntary basis. In fact, you were very brave, and I thank you very much for actually volunteering to come and speak about your experience. What was it like, and you suffering needlessly in silence for so many years, how it affected the quality of your life, how it affected you socially, professionally. You did have a minimally invasive procedure. What was that like?
At minimum to you, okay?
Yes.
They're all very invasive to us.
Well, for any man, when you're going down there, that means
off the top, it's invasive.
Yeah. Well, you're asleep anyway, so that's
usually when the most invasive things happen.
That's the
It's when you're asleep, when your guard is down.
That's right. That's right. And what is your life like now? How is it?
Well, Greg, first of all, let me say again, thanks for having me. And I think it's very important that we talk about our health issues publicly. You know, when I was a kid growing up, we didn't have those conversations publicly. We didn't even talk much about, the condom and that type of stuff. We didn't talk about, getting women pregnant and the impact of that socially, financially, in every kind of way you can think of on yourself, So I am glad that we as a nation are maturing enough to the point now where we can have these open conversations about things that relate to our health. Because I think everyone will attest, especially the older that you get, the more you realize, the car isn't as important as you thought. The style of telephone you got isn't as important as you thought. But man, if your health is in problem, then then you realize health is what it's all about. And one advice I could say to everybody is start early. Get yourself baselines done. Follow the guidelines. These guidelines are out there, and they're not just darts thrown at a dartboard by some guys on a Wednesday night in a pub. Okay, these are medical doctors who have studied us for years, studied effects of everything that we use for years, and have come down with guidelines that are presented to us that, if followed, will give us a better chance. Nobody could guarantee your great health, but all you could do is put yourself in the best position to succeed. So I do encourage you to start young. I had my first, the DRE, the digital rectal exam. That's correct?
Correct.
All right, the DRE. I actually had that live on the air, Greg.
Wow.
Yeah,
wow.
Live on the air.
Yes.
I was doing the morning show with Chrissy Love on Island FM, the Morning Boil, and I was turning 40. And I was approached, and I was thought that, we needed a way for men to understand it's okay to do these things. It's okay to care about your health. It's okay to go to exams. It's okay to see a doctor before you get sick, right? And so that was the whole purpose of this, is to follow the guidelines. So I had my 40th birthday came live on the air that morning. I remember, I think it was Dr. Roberts. We were down to Dr. Roberts' office right there in Oaks, over the hill there in 3rd Terrace. And live on there, 1 minute I was saying, no, good morning, Nassau. And the next minute I was saying, right?
Yes,
but let me tell you, that little second, after that man told me everything felt good, every discomfort thought that I may have had disappeared. And I was amazed because we're all the same, Greg. Let's be honest. And I think Bahamian men may be worse than most, right? We are very phobic when it comes to that area of our body. For some reason, we're very intimidated. We're scared. I don't know if we think having these exams are going to do something to our sexual mindset or in some way make us less of a man. I guarantee you, fellas, it is the exact opposite. Okay? Because you leave these exams feeling good. When you come back and it says, hey, you're in good health. Your chest goes out. You're feeling more of a man, right? So don't let those fears stop you guys from getting it done. Now back to Greg.
Well, I'll talk about the digital rectal because that's always
Okay,
the
let's
elephant.
go.
That's an elephant in the room. Anytime we
Okay.
talk about the prostate, obviously men cringes when they think about it. The thing about medicine, it's always evolving. So what was the gold standard 20 years ago might not even be the gold standard 15 years ago. In the last,
What are you? I have a feeling you're trying to say something to me here, Greg. What are you trying to say?
I'm trying to say that you
Put
actually
the gloves on and tell me, Greg.
you actually said something that can be troubling because you said, all right, I was told that they had the digital rectal exam and everything is fine. I often hear that.
Right.
And that's a misconception because even if the digital rectal has, even we're looking at guidelines, every specialty in medicine has guidelines, international guidelines. For me, I was trained under two forms of guidelines. I was AUA, American Urology Association, and EUA, European Association of Urology. Very similar.
So it's not like lawyers where you're either on the British side or in an American system. It's not like that.
It's not that. In fact, the European, in many ways, were a lot more advanced. So in terms of things that would come out for the Europeans, they may come out 10, 12 years before the Americans accept it. So they were a little bit more progressive. And it's not as much a capitalist medical system where the pharmaceutical companies or the big
pharma.
Big
they gotta
pharma,
make theirs.
are basically dictating everything that happens in terms of what's approved and marketing and everything else. In Europe, where a lot of the countries have socialist medicine, it's basically looking at studies that are going to improve the quality of life of patients without that money aspect basically corrupting the system.
Well, with the understanding that a better nation health-wise, the better nation across the board in every aspect. The healthier you can be as a nation, the better, the wealthier you are going to be. So health is wealth. And we have a lot of work to do. I mean, whether America is behind Europe or not, one thing I do know is we're way behind both.
Correct.
Right.
But we're catching up. We have every specialty available here. We have basically every innovation in terms of cutting edge, minimally invasive
Well, I just
procedures.
booked a colonoscopy for a couple of weeks, so I'm excited about that. Yay! Looking forward to that exam.
Hopefully within the year, we're going to have our first Da Vinci robot. So I was trained on the robot.
AI?
So basically, a robot means you have very precise, minimally invasive surgery. It's basically in terms of what patient go through. It's keyhole incisions where it's minimally invasive recovery.
I've had that because I had an aneurysm.
Yes,
And
you-
they actually went in through my vein in my leg.
Yeah.
And went all the way up the vein to do their clogging of the artery and stuff. So
Yes.
I've actually experienced some of that from personal point of view. So I've had some fun health things we can
We
discuss.
have interventional Bahamian
Yeah.
radiologists, so we have every specialty available here. And many of us have trained with some of the best in the world. So we made that sacrifice to go off to foreign lands and under difficult circumstances to learn under the best so that we don't have to have our fellow Bahamians going out to Atlanta or going out to Miami or going to New York or going to England to get that specialist care
Right. Could do it
where
right here.
it's going through any surgery or any kind of treatment, whether it's cancer or otherwise, is difficult. You want to be in your home environment. You want to be surrounded by your family and friends. You want to go home.
Recover better.
You want to go home to your own bed.
Yes.
Yes. It's even more terrifying to have to go and meet people and be in a different circumstance and surrounding and family or wondering what's happening and they can't travel with you. So that's a sacrifice.
Well, depending on your family is a good thing or a bad thing.
That's true.
But I want to go back to what you were saying about
so the digital rectal exam.
Because I did research to find a doctor with a small hand and all.
Yeah.
There are two doctors I refuse to do it because their fingers are a little NBA size for me. You mean to tell me now we don't have to do those digitals anymore?
So I'm talking about the American Urology Association, which I'll basically paraphrase in terms of routine surveillance for prostate cancer. The digital rectal exam has little to no role. First of all, it's very subjective. The next is what a lot of the public don't understand, and even physicians and a lot of general practitioners and internists don't understand, is that when prostate cancer is early, the digital rectal exam feels completely normal. That's when we're trying to pick up prostate cancer. So to tell a person that your prostate feels fine, you don't have cancer, you're giving them a false notion that everything is fine when you may have cancer. Even if you feel something abnormal, it's not necessary that you have prostate cancer as well. A nodularity can be from inflammation. It can be from infection. It can be from a previous biopsy. It can be congenital.
Yeah, but you know us, Craig.
Yes.
Yeah, any little thing we get, and we going straight.
So that's why we advocate blood tests.
The big C.
So we're annual from the age of 40, and every year after that, you want to get a PSA, prostate-specific antigen blood test, and you want to know not just that value in isolation, but we're comparing 1 year with the next. We want to compare, looking at the PSA velocity. Is there a significant change over time, even if your PSA value is still normal? That may cause us to do more other investigations.
So after looking and our baseline we talked about earlier, so now we're doing our PSA service. So what you would do if you see a change in our PSA, then we take it to the next level of testing.
Yeah, and it doesn't necessarily mean anything sinister because a PSA is not what we call very sensitive or specific. It's not specific for cancer of the prostate. It's specific to the prostate gland. So any inflammation of the prostate will cause it to rise. Gotcha. Any infection of the prostate will cause it to rise. If you have a very big, completely normal prostate, your PSA is going to be above normal. If you have any incomplete bladder emptying, anatomically the prostate is a walnut-sized organ that lies underneath the bladder above the rectum. If you have a half-full bladder all the time because you can't empty your bladder, you're going to have that pressing on your prostate. That's going to cause your PSA to rise. If I put a clothespin on someone's penis and they can't pee for 24 hours, their PSA can go from 2 to 28
I'm
just
getting
overnight.
flashbacks
Just
on this
overnight.
conversation,
Yes.
Greg, because if we could fast forward now, if y'all don't know, I knew Greg when he was a skinny little kid. Okay, he was my next door neighbor.
I'm hopefully still skinny. Yes,
my next door neighbor. Now I was always a little bit older than Greg, but he was always my little neighbor. So I ended up, I guess I would say about 8 years ago, I really started being affected by what turned out to be a prostate problem. I remembered the first time I think I really, really felt the effects of it. I was watching a football game, and I had to pee. And I went to the bathroom, and I just stenched. You know, my whole body just gripped me. I actually started sweating. My body was working so hard trying to urinate. Nothing happened. I'd never felt this before, right? And as you already know, I've already had a bunch of medical things, right? But I've never felt this kind of I did not know what it was. And it subsided after a little bit, right? The pain kind of went away and everything went well. Then a couple days later, the same thing kind of happened again. And I had started to have trouble urinating. I kind of knew I wasn't urinating properly. You mentioned emptying the bag, right? I don't think I emptied the bag for a very long time because, you remember how you used to pee as a teenager. I remember when I used to be at Waterloo, man, going to the bathrooms in the urinal, I was afraid I was going to break them, right? The stream was so strong. And then all of a sudden you're getting these drips, right? And you're celebrating drips, Greg. And you know what? And what happens to us, Greg, and I honestly think my fellow Bahamian men, and we kind of do with our governments too. We tolerate
It becomes
that's
your
a norm.
The
and
abnormal,
it doesn't have to be.
The abnormal
Right.
becomes your
yes,
normal.
you do. You make that, and I did. And I made my problem urinating my normal everyday thing. Right?
And it's a slow progressive change. Your prostate doesn't get big in a month. It doesn't
Right.
get big in 2 months. It's over a period of several years. Obviously, genetics play a role. Black men usually have bigger prostates than others. And in fact, when we talk about Africans versus Caribbean,
Right.
men of the Caribbean ancestry usually even have a bigger prostate than men of African
Really?
ancestry. We even have a higher risk of getting prostate cancer and a more aggressive form of prostate cancer than even our African counterparts. So in terms of what are the risk factors for prostate cancer, age is number one. Being of African ancestry is number two. So that's why we have to be very diligent in picking up prostate cancer in our country, because we tick all the boxes for having a high risk of getting prostate cancer earlier
Right.
than our other racial counterparts and a more aggressive form of the disease.
Right.
And we're not going to fare as well, even if we're the same stage as our Caucasian or Hispanic,
Right. The numbers don't lie.
Asian counterparts. We don't fare as well. We have a higher rate of recurrence as well. So even when we're quote unquote cured, you still need to be diligent in following up, make sure that there's
You
no
mean this can
recurrence.
come back?
It can always come back. That's
Oh,
why.
man.
That's why it's important. So what has happened in the last few years is it's not just a crapshoot. Who's going to be affected by it coming back? We actually do genetic testing on either the biopsy sample of the prostate, the tissue sample, or on if we actually remove the prostate. So you don't need to necessarily remove the prostate to cure your prostate cancer. There are numerous ways that have excellent cure.
Is that the last recourse?
There are many ways that there's no right or wrong. There are patient factors. You might have different comorbidities. It might be because you're of a certain body habitus. You may be obese. There are the things that
How big
play
a
a
role
role.
does economics play in some of these decisions for us, Greg? You know,
It-
a lot
it
of us
can.
out there are struggling.
Yes.
Not everybody has full private insurance, so that's going to kick in and help with these
Well,
things.
through the public system, you can always get prostate cancer treatment, and it's very well subsidized, even through NIB. For example, if you have advanced prostate cancer, you can get very expensive medication absolutely free. So there's no reason why, even if you need radiation, it can be subsidized partly or completely by the government itself. If you need surgery, that's completely readily available through the public system. Obviously, there's always personnel issues, there's always equipment issues, there's
Right.
operating time issues.
Right.
That's another story in itself. But you will eventually get done.
Right.
You will eventually.
And don't
get
wait, fellas. I can tell you, I waited way too long. I don't know if you remember my case
Yes,
at
I
all,
know.
Greg. But I waited till it was very bad. I waited till I wasn't sleeping at night. I can't, honestly, before I had this procedure, I don't think I had a comfortable night's sleep in probably 2 years. Where I wasn't urinating every, or not even trying to.
Yeah.
You know,
so
every couple
what
hours.
happens is the prostate grows in front of the bladder, around your urethra, your pee pipe, and basically where you're supposed to have a wide open bladder outlet, it basically envelops and encloses off. So a lot of men, instead of peeing through a big open hole, are peeing through a little slit. You're never going to be able to empty. And they'll think that they're emptying because over time, your bladder usually will progressively increase in size as well.
Right.
It'll become more muscular, contract with a greater force to be able to generate even a decent stream. The bladder can only, in layman's term, expand to a certain degree, and then it loses its elasticity. It loses its ability to contract. You develop what we call an atonic bladder, where it's almost a flaccid balloon, where it only contracts partially. Well, you're never going to be able to empty.
Right.
So even at that stage,
Sounds like my belly's an
Yeah.
atomic type.
Yeah. So even if at that stage we resect your prostate, we reduce the prostate, and I'm going to talk,
Right.
there are many ways that we can do it, your bladder will never function properly. And we don't want to get to that stage.
Well, you know what did it for me, Greg?
Yeah.
Despite all the conversations about it and all my discomforts, but, sleeping at night and even during the day, can't drink alcohol.
Yes.
2 drinks, and man, your body wants to, and you can't. That was the worst thing for me. So that sped things along. But what really did it for me was a conversation you and I had, and it was one of our first meetings when we were actually just discussing the whole thing in general. And of course, you're telling us, of course, we have this bag in it, it fills up, so it's never emptying,
Yes.
right? So and then I think you told me to imagine, a tank or something with trapped water, never emptying. What's going to happen to that liquid that's in there? And I thought about it. It got to get nasty after a while,
Yeah, so
right?
you're going to get recurrent urinary tract infections. Men really shouldn't be getting urinary tract infections. Their urethra is so long, some longer than others, but a woman, they have a very short urethra. Anatomically, they're predisposed to get infections because their anal verge and their urethra are very close. So that's why we always teach the kids about the way you wipe.
Right.
Because you can keep giving yourself infections.
Yeah. It's really a poor design.
Yeah.
This is a design flaw. We can all admit it.
Yeah.
Let's admit it. It's a design flaw. All right. But
So-
that's
yeah,
what really
so when you're
that
walking,
kicked into me.
when you're walking around with a pool of urine day in and day
Correct.
out, bacteria is going
Right.
to proliferate and grow, and you'll never get on top of the infection.
Right.
You can take antibiotics over and over. Eventually, you're going to get multi-drug resistant bacteria. You're going to have to be admitted to hospital for intravenous
And I was
antibiotics.
close to this.
Yes.
Now, I was close because I was silly. I waited I again did what we discussed a couple minutes ago. I made it my norm. I made the pain and not being able to urinate a part of my life. So it wasn't until my wife pushed me and until, I got good consultation that I decided, okay, I got to do something about it. So I committed to doing this procedure, all right? Now, as the procedure was explained to me, we were going to open the hole, okay, and allow for better, movement, all right? It makes perfect sense. Anyone who's ever been to the beach and built a sandcastle can kind of understand what we're talking about here, right?
So
Movement.
essentially, we want to take a 55, a 60-year-old, a 68-year-old's prostate, which inevitably is going to be enlarged, particularly men of Caribbean ancestry. They do it by decades. Usually say 50% of 50-year-olds, 60% of 60-year-olds, 70% of 70. But it's actually probably about 70% of 60-year-olds
Wow.
are going to have
Prostate,
inability
wow.
to empty their bladder. And that can manifest in many ways.
Wow.
A weak flow, a difficulty in initiating a stream, dribbling as you walk away from the toilet, waking up more than once in the night to urinate. You don't. That's an abnormality. The other thing is that you're also going to have an issue where you're going to be peeing more than 8 times in the day to
Not just that,
Yeah.
you sit on the time I was wasting. I got to the point, Greg, where I had to sit on the bathroom
Yes.
because I was there for so long,
Yes.
right, hoping to
Yes.
get rid of urine because you're not empty. You
Yeah.
know you're not, right?
Yeah.
So I sit there. I actually have to sit on the toilet
Yeah.
to go to the bathroom, and I'd be in there for 15 minutes,
Yes.
20 minutes, hoping
Yeah.
to get a stream, right? So anyway, so
Then we talk about what is affecting. It can negatively impact. There's back pressure on your bladder. There's back pressure on your kidneys. You're going to develop what we medically call
Hey, do you remember
hydronephrosis of your kidneys.
you old enough to remember Lethal Weapon?
Yes.
Do you remember the scene when he was stuck on the bathroom?
Yes,
Right?
yes.
Danny Glover's on the back, and he was there so long, his legs froze, and he couldn't move, and there was a bomb there, and Riggs had to come in. I've been literally like that, where I sat on that toilet so long, hoping to urinate, my legs are gone numb and paralyzed. I've turned and have to crawl off the toilet.
So you're at the nth degree when you can't even urinate or initiate a stream when you're standing up. You have to use all your intra-abdominal
every power
muscles
you got.
to bear down and
And it
try
makes
to
you
push
cackle
up.
all the time, too.
Yes, yes.
Because you're pushing everything.
And another sign that you're not emptying your bladder is you're straining to pass stool, or you're even gently passing stool, and all of a sudden you pass urine because your bladder is always full. You're pushing down using your intra-abdominal muscles, and you're gonna be passing some urine, and you're not expecting it. Right. That's another sign of that. So a lot of
Not
men
a
will say,
sign
you know
wanna
what?
see. Yeah.
I'll ask them, how are you doing with emptying your bladder? And the men will say, oh, I only pee once a day. That is something in itself because,
yeah.
first of all, you might be in renal failure. You're not producing enough urine. It might
How
be.
often should we pee, Greg? I mean,
So you want to go more than 2 hours. Obviously, it can be affected by.
So every 2 hours is reasonable to
That's
urinate.
reasonable, but it can be affected by some men think that they have to drink 20 gallons of water every day. Even if your kidneys
You're
are
gonna
perfect,
urinate
even
more.
if your prostate is small, you're going to be peeing all the time. So you have to look
You
at
have coffee 11 o'clock at night.
You look at what you're drinking, the volume that you're drinking, etc. Caffeine.
But we're
alcohol.
told to drink all of this water.
Well, we want to have on average 5 to 6 ounce glasses of water a day or
Right.
equivalent. Obviously, if you're out in the sun, you're perspiring.
Yes, you need more.
You're going to need more, obviously.
Right.
So you have to look at every individual as an individual. So what are your symptoms? Some people are happy waking up 5 times in the night. Maybe their wife, who's also waking up, isn't
Right.
happy that, but
Right.
that's become their normal.
Right.
How many men are driving with a cup or a container to urinate into because they can't even get enough?
I've kept a cup
Ti-
by the bed before.
Yeah. There's
been
there
down that
are
road.
men who are their norm is they can't even wake up enough,
to go. So what you end up doing, I'll tell you.
or
what,
they'll have a bucket.
Yeah, and I've done it with a bottle or a cup, and you just roll to your side. And the stream is so little, you can do that.
Yeah.
Without fear of splattering.
Yeah, so
urine
you
all over the place.
shouldn't even have to live with that in dignity. And
And I did, Greg. I did for years.
and I mean, come on, your wife is right next to you and you got a bucket
but
smelling
you know
your
what?
urine.
Yeah, but you know what?
Yeah.
She didn't know.
Okay.
Because I cleaned that out.
All right.
I do my thing. I get up before her every morning. So that
Yeah.
cup I may have gotten to the night. By the time she wakes up, we hide it.
Yes.
We do.
And I think you hide it
We
from
hide
yourself.
No, we hide it from
You hide the reality of what's
from
going on
everybody
from
who
yourself.
loves us. We hide it because
Yes.
we know we need help.
Yes.
And we just don't want the wife denied. We don't want our mom denied,
And-
dad, brother, whatever.
And most men don't want to see a doctor. They don't
Of
want
course
they don't
not.
want blood taken.
You go to them when
Yeah.
you're sick. That's the only time you think you're supposed to go to them.
This time bomb can cause you to have kidney failure.
Yeah.
Acute, and if you leave it long enough, chronic renal failure.
Well, you're fighting a lot of culture here for Bahamian men. I'll be perfectly honest. I grew up in an era when we thought of going to the doctor to die.
Yes.
That's when you go to the hospital. That's when you go to the doctor. You're gonna die soon. We have to get away from that mindset. And so it requires a lot of education. Again, that's why shows like this are so good.
So for men, women, and kids, I'll always say, don't let the bladder rob you of your happiness. Don't let the bladder control your life. Don't let where the next bathroom is dictate how you live.
I can't go because I gotta wait to
There
make sure
are
I check
persons
first.
who won't have even a glass of water at work
'Cause they know.
because they're embarrassed that their colleague's going to see them going to
It's
pee
gonna
every
trigger
15
them
minutes.
off, yeah.
Or they can't function professionally, or they're teaching in a class and they know if they drink anything,
Right.
they're going to be excusing themselves all the time, or they're going to be not making it to the
You
toilet
adjust
in time.
your lifestyle
Yeah.
to make this discomfort work. So I get this, and now I'm ready for surgery.
Yes.
All right. So guys, the prep and everything is all that mentally you wrap your head about what's about to happen. I'll tell you how the surgery went. My wife, I think she drove me to the procedure. You go there early one morning. Basically, you are put to sleep. I felt nothing. I could say that. I was comfortably put to sleep. And again, fellas, or I guess some ladies out there, if you are concerned about that procedure, please do not be. I know you never want to call anything routine, but these guys have that down to a science, literally. It is,
And the take-home message is that there's more than way to skin a cat. There are at least a dozen different ways that we can resect your prostate. It's an inevitable part of getting older. It's the most common procedure, and I'll use the word procedure over surgery because there's really no recovery, that any urologist in the world is going to do, because inevitably, if you reach a certain age, you're going to be placed on medication as a first-line treatment. Eventually, slowly but surely, that medication is going to be less and less effective because your prostate reaches a certain threshold in terms of size, and the medication eventually becomes ineffective. And you need a procedure. And there are many ways that we can do that. So we'll talk about all the different procedures that are readily available. And
I'll tell you what happened to my procedure.
on the other end of the bake. This is Urologist Speaks.
Girl, you see how Cora eye look funny, all black up yesterday?
But she say she bump into a wall when she's running after the churn them.
Yeah, but last Saturday you see her arm was all black and blue, right?
What you saying? You think something wrong between her and Jack?
I ain't sure, but you know Jack is a jealous man. I hear him and Cora last Friday. I hear him say he hear Cora have eyes for Junior.
Now you know that ain't true. Cora is a good woman, does mind her business, take care of them churn, and go to church every Sunday. So what you think we should do?
I think we should report Jack, Cora don't say nothing, but silence hides violence, and we don't want to line up in the cemetery.
Not me. I ain't getting in nobody business. Then Jack come after me, and I land up next to Cora.
No, man, we could call a text Crime Stopper. And remember, we can even get some grocery money for our tip.
Remind me again, how does this work?
We can call them in Miami at 328-TIPS or 328-8477. Or when we in the island, call toll-free at 300-TIPS or 300-8477. And if you don't have no minutes, use the Crack Crime Bahamas app and we could text them. And the messages get on mix up before it leave your phone so nobody can know what you saying?
So what we waiting on then? Let's go earn some grocery money.
You try to rest, but roll with the best. For all your printing needs, there ain't no one better, no. For posters and banners, magazines and flyers. For window decals, greeting cards and newsletters. No job too big and there's no job too small. You name it, we can print it. Just give us a call. Let Print Masters bring your masterpiece to life.
Located in the Nassau Guardian Building, telephone 302-2361.
Always on the go? Missed a show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Welcome back. This is Urologist Speaks with BAME Urologist Dr. Greggory Pinto, and it's my great pleasure to have veteran radio host and BAME cultural icon, Mr. Eddie Cotter, in the house.
Icon's a strong word, but anyway.
I think you well deserve it. No one's going to argue that. But we're here talking about enlargement of your prostate,
Yes.
specifically benign disease, benign prostate hyperplasia. What your experiences were with that inevitable disorder that every man will face as he's blessed with advanced age. And minimally...
And you're right, it's
Yes.
a blessing. We forget that. I'm glad
Yes.
you said it like that because, the only alternative to getting old is dying young.
Yes.
I think we got to remember that. We feel bad we're hitting 60s and the 50s, but you know what? We've all had friends and relatives who didn't. So be thankful for that.
Yes. All right, so you were one of those notorious ones that ignored the symptoms.
I did.
Suffered needlessly, had a lot of sleepless nights.
Lots of them.
And I'm sure dreaded drinking in public because you
Stop
didn't know
drinking.
that.
Stop drinking.
And that in itself obviously is going to affect
That's the
your
one good thing that's come out of this.
Yeah.
I haven't started either, so
Yes,
I've continued not drinking. But anyway.
Well, even drinking water.
Yeah,
Some persons
yeah.
can't even drink a glass of water.
You're right. Because you don't want to. Because it hurts when you
Yeah.
have to try and pee, so you avoid.
Or they'll stop drinking at 5 o'clock in the evening.
Yeah.
Because they know they'll be peeing, or they'll be peeing all night.
Yeah.
Just even as a urologist.
And when you
that's
get
gonna-
late stage, that don't work.
Yeah. It's going to affect your kidneys. It's going to affect your heart.
Yeah.
It's going to affect your general health.
Yeah.
You're going to be exacerbated by being dehydrated all the time. Your mouth is dry. And not only that, you can be at greater risk of developing kidney stones. And that's the most painful thing known to man.
See,
You
kidney
don't want a
issues
kidney
run in
stone.
my family.
Yeah,
So
yeah.
that was another thing that once I was educated on that fact, the fact that, because I was, as you just mentioned, because it's your defense, you
Yeah.
don't drink as much.
Yeah.
Right? Because, obviously, if it hurts trying to pee, avoid the liquid. But just like you said, I have kidney issues in my family. So one of the worst things that I could absolutely do in my life is stop consuming liquids.
Yeah. So, as I said, it happens to us all. So
Yeah.
we're talking to everyone. If it hasn't happened to you
Yes.
yet,
It will.
you know someone who in your family is of that age, and it's going to affect them. So it's just I'm just giving you a warning. Look for the signs, look for the symptoms, and don't suffer needlessly. Don't ever let the bladder control your life. If you're waking up more than once in the night to pee, you might be the culprit itself. You might be drinking too much in the way of liquids. You may be having
lifestyle is a big part
if you're
of
having
your
6 beers before you go to bed, obviously you're going to wake up 5 times to pee. If you're having a cup of coffee, you're not gonna get a good night's sleep, and you're gonna be peeing all night as well. So,
All right. So I designate and decide to anoint a particular Saturday for this wonderful procedure. Right. So I held the procedure. Like I said, it was very smooth. Check in, boom, boom, boom. No discomfort. You take your sedative. I wake up. It's all over. Again, the recovery of procedures, I think, is something that maybe we don't talk about enough, Greg. And I'm across the boarding this for medical professions. I do not think doctors do tell us good enough what to expect when it is over. Because some things in the recovery thing were scary. I mean, let's keep it real, because the procedure now, I got cut inside me. Now, everyone knows when you cut a part of your body, what does it do? It scabs, right? It did inside too. So what happens for the first part of first couple days after this is you do urinate blood, and you usually have a bag. So you're going to have a bag at first that you got to change. Right?
Well, usually, so everyone is different. It all depends on the size of the prostate.
Right.
For example, someone who has a normal size prostate.
Like you hope not to have to take home a bag.
Yeah.
But most people do, right?
So it's minimally invasive. They're different. I'm going to highlight the different, I won't go through all 12 procedures, but there are different ways of doing it. Some are just going to temporize you. So in the capitalist medical system of the United States, where they'd love to see you every 3, 5, 7 years, they would resect just enough prostate so that you're happy with your symptoms, and then they're going to come right back. I like to do one and done, where we're going to resect enough.
I believe my car dealer with my tires is just like that too. Every 6 months.
Yeah, so I don't live my life by greed. I live my life by the happiness of my patients. So I would like to not have to see you for 25 years.
Right.
And for most men, they're 65. If they reach 25 years and they got a problem, they'll be happy at 90 to come and see me again.
Yeah,
and
if I got to deal with that, then that's okay.
That's a small price to pay. But everybody's different.
Yeah.
Some people, in terms of the vascularity of the prostate, it's a lot more vascular than others. So some people...
So what makes an attractive prostate?
Enlarged.
You're sounding pretty intimate while you're starting to talk about these prostates out there, Greg. Tell us what makes an attractive prostate. If we were to talk to our prostate and tell it we want it to be like something, what would we want it to be like?
We want to see somebody early in the game where they were on medical treatment. The medical treatment started to be less and less effective. They weren't emptying the bladder. But this is early part of the game where it's only been happening for a few months, not for a few years, where your bladder has taken some knocks where it's never going to be completely normal, and that can have issues post-operatively. You can't do surgery on the bladder. The bladder, even if we reduce the size of the prostate and the bladder is no longer obstructed, over time, the bladder usually will go back to normal, as normal as possible. But some people, their bladder is in such bad shape, maybe we're hoping it functions 70% or 80%. The bladder filling sensation is poor. They can't even really feel when their bladder is full. Their contractility, the motor activity of the bladder is poor. They're not contracting the bladder sufficiently to allow you to empty your bladder. So you don't want to get to that stage. There are dozens of men in this country, because they were stubborn, because they never wanted to see a doctor, even if it's for 20 minutes to find out what the problem is, get on some medication, and get a simple blood test, are on dialysis, where they have to get dialysis access, where they're waiting for a kidney transplant, where they got to wake up 3 times a week, 4 o'clock in the morning to get dialysis. Yes. And that just completely reduces the quality of life. Even if you get a kidney transplant, the average kidney transplant might only last 12 years. You got to be on immunosuppressive drugs. You're going to be at risk for a lot of infections. Those medications have side effects. So we have 2 kidneys. We don't want to have to lose one. But if you're not emptying your bladder, you're in danger of losing both of them, because there's continual back pressure on both of your kidneys because your bladder is always full. That's going to cause initially acute deterioration of your kidney function. And if you let it last for 6 weeks or more, or depending on how severe the problem is, it can lead to irreversible chronic renal failure, where you have to be on dialysis waiting for a miracle of a kidney transplant.
Right.
So we don't want to even go near that and get... Medication is so effective. You can have men who are peeing 5 times a night, dribbling every time they pee, feeling like urine, smelling like urine all the time. We can put them on a simple medication. Within a week, 2 weeks, they're peeing like a young man again. Your prostate will continue to get bigger.
You do. It's a very... Let me tell you, the first time I peed fully, like really... I'd gotten rid of the bag. I'm fully right with me. I was so proud of myself. I felt young. I felt strong again. I was like, it was such a great sensation to sit there and to hear how strong my stream sounded when it was hitting the liquid in the toilet. was absolutely an amazing feeling. It was really quite surprising to me that it would take so much pleasure. So you go through this procedure. In my case, I went through the procedure where they actually shave and create space again. And then Greg gave me the great news that I got in just in time, right? So anyway, I get this done, and I'm going through the recovery process. And like I said, during the process, in my case, I did have a bag that I had to use for a couple of days. And then you start peeing on yourself after a while. And, you got to get used to little bits of blood coming in there because, you did have a shaving procedure done. And then the scar tissue, which is a very weird sensation coming out of your penis. It is the weirdest, craziest feeling, but it's also a very cool feeling, if it makes any sense. It's how some women like to pinch pimples because of how it feels when it pops? It's like that. This is like when it pops through, you're like, wah! So it's really good. So that happens for a couple of weeks. Well,
that's a little bit of a misconception. For the procedure you had, there's actually no tissue coming out. All the tissue's removed. So when you have a bladder hematoma, a little blood clot, it can basically calcify as it lays in the bladder over time. And when it comes out, it feels like a soft, malleable piece of tissue, but it's actually not tissue. There are some procedures.
You can science it all you want.
All right.
Have you ever had it done?
No, I haven't.
And you better listen to me as I tell you how it feels.
All right. But just to clarify, it wasn't tissue where you were passing.
You don't care when it's passing, but it is.
I hear you.
You only know there's stuff passing. Now, you did warn me that this would happen, so I wasn't, scared or thought that there was anything wrong. Obviously, you want... And you have any type of, surgery or procedure, if you will. You've got to recover.
Putting in perspective, your size of your prostate, a lot of urologists would have said, is beyond the scope of minimally invasive resection. So I pushed the envelope.
Yes.
Trying to help you out.
To avoid a bigger surgery.
Yeah.
Right.
We didn't want to do any open surgery or anything else.
Right.
So that...
Again, why you have to have early detection, people.
Yeah.
I can't think of an instance where late detection is better than early detection.
Yeah.
Can you? You smarter than me. I never went to college. Can you think of any instance where to discover something on your body or something medical about you is better to do it later than early?
Absolutely.
If you want to cure it.
So a normal size prostate is 20 grams. Once it gets 40,
right.
I've worked in Germany, France.
Right.
For a Caucasian man, when they say a 40-gram prostate, that's huge. That's
So 20 is normal.
20 is normal. 40 is
huge.
For a Caucasian country, 40 is big.
How big was mine?
60 is like, oh my God, this is humongous.
Talk to me.
Yours was like 110.
Yeah, baby. If you can do something, you do it right. Wow.
So here, I'll routinely see 70, 80, 150, 200-gram prostates all the time.
Wow.
And all the time, my counterparts in other countries will never see that.
Right. Well, you're welcome, Greg. Let me just say that. Yeah, you're very welcome for giving you something to talk about when you go to your conferences around the world. You're going to be in Hawaii talking to the other doctors from Germany and tell them, no, I had a guy who was 120.
So I actually had to adapt what I did because for the procedure that we do here, the most effective way of removing a huge prostate, there are 3 different ways. There's a HOLIP, which is a holmium laser enucleation. There's a TULIP, which is a tulmium laser enucleation. And then there's a bipolar transurethral section of the prostate.
Honey, translate that for me later, okay?
So a bipolar TURP has the advantage that you can leave some tissue strategically. So even if your urethral external sphincter that allows you to control your urine is weak, which is very common because your prostate is so big, it's slowing down your urine. Right. The sphincter that is supposed to be slowing down your urine hasn't been doing the job it's supposed to do for years. So inevitably your sphincter is going to be weak. If we do a nucleation, that means basically taking almost the entire prostate out, and every time you cough, every time you sneeze, you're going to leak some urine. That's going to affect your quality of life.
Yeah, it's like I wear a little diaper or something. Huh?
If you scope the patient and you look, it looks perfect because there's no prostate whatsoever. The prostate's the size of a 12-year-old.
Yeah, but I'm wearing a diaper.
Yeah, exactly. So for that reason, only for select cases, I would employ that modality. Right. So during COVID, everywhere in the world for a bipolar transurethral section of prostate, you admit someone overnight and you wash out their bladder with continuous bladder irrigation. You have a 3-way catheter. It's a painless irrigation. Right. But because we never had any beds, I stepped the prostate's cases never stopped coming.
Right.
I had to be basically change my management where I would send somebody home. I had to be very diligent in making sure they got hemostasis, that their urine was clear.
Right.
So I had to go to the point where I would speak to colleagues around the world, and they just don't believe it's possible
could get away
to
with what
send
you
somebody
do.
home.
Right.
And I do that every single day that I operate because I do so many cases.
We're making you a star, Greg.
Yeah, very much so. In fact, one of my profs actually encouraged me to write a case study and
Spell
publish
my
it in
name
a
right
journal.
now.
I will.
Spell my name right.
So sometimes hardship, you got to adapt, and you need to.
And I think that's a relatable story because I think all of us in our job place can relate to what you said. When something didn't exactly be perfect, you use your experience, you use your skill set, and you find another way to get it done.
The bag for most men is not that bad. First of all, it's waterproof. You wear a pair of pants, no one even knows you have it. You basically, after the procedure, by the time you go home, everybody's different.
I hear you, and it may not be that bad. But psychologically, it's not.
Very much
is.
so. But for most men, you come to the office the first thing in the morning. We take the catheter out.
Yeah.
We
come there before everybody shows up. That's why we come early, Greg.
Yes.
Because it's embarrassing to run around with a bag of pee.
Well, you have a pair of pants no one even knows you have.
You know.
Yes, I hear you.
Right. So,
but it's a small price to pay.
That's where I was going to end up. Believe me, I was going to end up there. Because I will say, even though, the recovery was those weeks and the bag was a pain, despite what Greg may say, Dr. Greg may say, it's a pain in the to have that dangle in there and change it. The wife had to help me. That's never a mental pleasure thing, right? But let me say, despite all of that, giving up my good Saturday and all to have this procedure done, I would do that again in a heartbeat. I think I could honestly say, I guess besides my aneurysm, which was really, you're going to die if we don't do this now. Besides that, I have never had a medical procedure that has improved my life as much as this one. I cannot tell you how much better it is now not to be in pain when I have to urinate, to know that I will not be waking up every 20 minutes to sit on the toilet for another half hour trying to urinate. The fact that I can plan my day out normally, I don't have to make sure we can't go yet. I got to go to the bathroom before we go, and everyone got to wait a half hour before I could come, before we could leave, because they got to wait for me to try. It is a life-changing, and I dare say, a life-saving procedure for me. My life is so much better because of that procedure, Greg. I'm not happy with myself for taking so long to do it. And taking that chance.
Better late than never.
It is better,
and
but
we
don't
got
wait.
it.
Yeah.
So, putting it in perspective, you talk about a catheter overnight after a minimally invasive procedure. There are probably 500, 600 men in this country
minimally invasive procedure
who are on a catheter
Right.
because their prostatic obstruction is so severe, they can't even initiate a dribble.
Correct.
And they've already started to go in renal failure.
Correct.
And they have to live their life on a catheter.
The ends does justify the means. I get where you're going, and I agree with you 1,000,000,000%.
So a lot of patients will already be on a catheter, if not for months, for years.
Right.
So to tell them that they're going to have a catheter just one more night is nothing. Is absolutely nothing. It's a joy.
Yeah.
It's a joy to think the end is the light's at the end of the tunnel.
Let me tell you, I can't point to a day in a calendar, but there was a feeling that all of a sudden I was fully recovered. And I was normal. I was peeing strong normally every time I went to pee. And that was such a great feeling. And let's talk about the other important thing about this, Dr. Greg. Now, see, we can talk about the important stuff now.
Yes. Well,
how am I going to work after it is over sexually? Anytime we go to any doctor, you all touch any part of our body down there, the number one thing going through our head,
well, you read my mind. You read my mind.
Literally going through both of our heads.
Yes.
Right? Is, am I going to be functional after you're done?
So, in fact, this will improve the actual quality of your erection. If you're trying to get an erection and be sexually intimate and your bladder is always full, a lot of men have embarrassment because they're actually leaking during foreplay. They're having discomfort when they're trying to be intimate.
Right.
So this will not only not affect your erection in any way, it'll actually improve your erection.
You know, the favorite thing you ever said to me was, right? you should be able to have sex whenever you want. I was like, that's my doctor.
Very true.
That's when you won me, baby. That's when I
Very
said,
true.
you know what? I'm going with Craig. I'm going with him. Because, we should be. But let's be real. There are a lot of men out there. Sex is becoming, it becomes mental. Right? Because you're not performing at the level you want to be performing at. And that starts to beat on you mentally. So when it comes time to have sex, you are caught up in the game. Am I going to have a proper erection? Am I going to be able to satisfy my partner? Am I going to be able to do this? And so not only do you now have a physical issue that's stopping you from having the sex you should be having, but you have a mental issue that's beating that problem into your head over and over again. And trust me, that is way too much to go through.
Yeah.
And you don't need to.
So that brings up an important point. Medical management.
Bringing it up. That's what I'm talking about.
Yes. Medical management is always the mainstay of any enlargement of your prostate. It's not always going to work. Some people get a lifetime of emptying their bladder on this medical management. But for the most part, maybe you'll get 8 years. Maybe you'll get 10 years. Maybe you'll get 15 or 20 years.
Right.
But eventually, the medication is going to be less and less effective because your prostate continues to get bigger.
Don't wait, guys.
Yeah. So there's an alpha blocker medication. Men will hear the term and they know if they are not taking it, their father took it, their brother took it, their uncle took it, the granddad took it. Flomax or tamsulosin.
Yes. Flomax. Let me tell you, Flomax before this procedure I had to have Flomax with me all the time. Got so bad, I used to double take them to try and pee, right? If I was going out, maybe having a drink, and know I was going to have a couple of drinks at a party, I would take extra Flomax to try get ahead of getting that prostate open up enough so I could urinate.
And some men are embarrassed to travel because they're on a plane. They didn't drink anything probably for 12 hours, being afraid because they know they got to pee all the time. And they're embarrassed that the whole plane will see them going to pee in a 2-hour flight 5-6 times.
Got to sit on that end. Got to sit on the aisle row because I'm going to be moving all the time.
Exactly. And that's no
in
way.
Movie theaters too?
Yeah.
How about that? How much of the movie are you missing?
None.
You come back. What did I miss? Right? Because you go to the bathroom so often. Now you're there the whole time.
And if you're waking up 5 or 6 times to urinate, a lot of men take an hour to get back to sleep. So they're walking around like a zombie. And as you get older, you might be in your 70s. You're not as nimble as you used to be. Waking up in the night, you're already feeling bad enough because you're waking up a lot of time your spouse. So you don't want to put on the light.
Right.
So a lot of men are actually falling.
Yeah.
And they're at the age where they may have some osteoporosis.
Falling's not a good thing.
They're going to get fractures. The life threat. And there's a patient, I brought it up before. He's actually told me to tell his story publicly so people can learn from it. This is a man, middle age, between my age and your age. Family,
that is
wife.
not middle age.
Okay, a little bit older.
Yeah, okay.
And he had traveled that day. That day, he went to pee. Peeing incessantly throughout the night.
Right.
He didn't want to put on the light to wake up his wife.
Right.
He literally tripped over his bag, went head first through the wall.
Oh my gosh.
Cervical spine fracture, quadriplegic.
What?
And these stories happen.
What?
Yes. Because
falling in the night going to the bathroom?
And it happens a lot. There are men who have fractured their pelvis. There are men who have fractured
I've bumped my toe before, but wow.
So even for that reason, you need just 7 hours sleep just for your cardiovascular health.
Wow.
So it's not just reducing the quality of your life. It's reducing the longevity of your life. You may not feel that, but you're going to live a lot longer if you're getting those 7 hours of sleep. If you're drinking a sufficient amount of fluid and you're not dehydrated, you're going to live longer than someone who's getting maybe 3 hours cumulative sleep and not even a good amount of sleep. And it's going to affect you socially. It's going to affect you professionally.
Hydration is so important. It's one of the things I'm learning as I'm hitting 60 now this year,
and then
how important that
think
is.
about it. So many of these men are so fatigued. They're falling asleep at the drop of a hat. They got to drink caffeine all day long. Yeah. And what does that do? It exacerbates the problem.
And those caffeine drinks,
yeah.
right? Those power drinks.
So they already had a reason that be peeing every 15 minutes. Now they're peeing every 5 minutes.
Right.
There's some persons that I've known who have basically had to stop working because they just couldn't control their bladder. So I say, get control of your bladder. Never let the bladder or the prostate rob you of your happiness or your quality of life or your
woman.
or your erections.
Oh yes, or your woman. Believe me, that's where y'all need to concentrate the effort on. If you want to stay drinking your beer, stay pleasuring your wife and having a satisfaction, a home sexual life with your significant other, you need to go see the doctor and get that thing checked on.
And there's so many men who are become so innovative in the bottles and the way they create this hole in the bottle so that they can quickly, with 30 seconds notice, be able to unzip their pants while they're driving and get it into the hole in the bottle.
That's I mean, oh man, if people out there are doing that
all the time, particularly taxi drivers.
That's incredible, Craig. Greg, it shows really how much work we still have
or
to
police
do.
Officers.
But it shows how much work we have to do with the mindset of particular Bahamian men. We are so, I don't know, intimidated by the process of seeing a doctor or ashamed or whatever that we're going through that. Oh, guys, come on.
Or police officers, because of their uniform and the amount of respect they garner in the community, they don't want to be seen running from their squad car to the back of a tree to pee, because they're going to be frowned upon. So they literally have to have a container to pee into, and you don't have to live like that.
Don't do that. No.
Flomax, as you mentioned, is effective.
Yes.
Not every man can take Flomax. Some people, unfortunately, have side effects. You always take Flomax at night because it can somewhat make you drowsy. The type of medication, it's in a class of drugs called an alpha blocker, where it actually can cause you to feel a little bit lightheaded. It can lower your blood pressure. If you're already prone to have low blood pressure, it's the wrong one. It can cause some nasal congestion in some men. For some men, it can cause initially some retrograde ejaculation. Some men will say, why all of a sudden is the ejaculate volume so small? A lot of times it's harmlessly going back in the bladder, and then you just pee it out afterwards.
Right.
Over time, usually it corrects itself. And if you stop the Flomax, it'll start going back to normal.
How long should I be using Flomax? I mean,
as long as it works.
It can be a lifelong drug.
So once you start, the problem, and I always like to preach that in every form, and particularly in this one, we treat the root cause. The root cause is enlarged prostate. The prostate is not being reduced in size by the Flomax.
No.
The Flomax basically relaxes the bladder and helps facilitate the emptying of the bladder.
Right.
But what happens is that the Flomax is treating something, and the problem is just getting worse. Because as you get older,
I used Flomax for years, and it didn't fix me.
As you get older, your prostate gets bigger and bigger.
Worse,
and then
so basically, it just puts stuff off.
It does.
I mean, all we're talking about is forcing you or giving you the luxury maybe of a little time if you think you want to have the time. But the longer you wait, the more chances you're taking.
Exactly. And then I'll say something.
So it's a dangerous insurance
So
policy.
if you're on Flomax, now this is some wonderful news men can take to heart. You can take a daily Cialis, 5 milligrams, along with the Flomax, and it's more effective in many long-term randomized control studies with tens of thousands of patients done in different countries and top institutions in the world. It's more effective to take Flomax plus a daily Cialis, and Cialis is known to give you a good erection.
Right. And that's my combination I was on. I'm the poster child of what you're talking about.
So
I was on that combination.
You can tell the wife and the girlfriend you're on the Cialis daily.
Right. Because I'm taking the Flomax. Not because I'm less of a man, but it's because of the Flomax causes, some troubles.
Because it's helping you empty your bladder, get you a better flow.
Right.
But the side effect, unfortunately, is you're going to get a great erection.
Right.
For the most part.
Darn.
So, sorry to say that.
But again, Greg, I think we should emphasize it's not a combination you want to be using for years. It's what I was on. It didn't fix me, right? I didn't get fixed until I actually got something done. I mean, it eased some of my life. And I don't know if this is typical or happens to others, but it worked great at first.
Yes.
Right? And then after a while, it didn't seem to be quite as an effective a combination anymore.
Because your prostate is continuing to get bigger. There are medications that actually can shrink your prostate. That's called a 5-alpha reductase inhibitor. Avodart or dutasteride is something that a lot of men will hear that name. Finasteride is another version of it.
I think I've been on Avodart before, too.
But the problem about it is most men, and studies have shown that, will not stick with Avodart.
Right.
Because it kills your sexual drive.
Oh, there you go.
So any man who's middle-aged will rather pee incessantly than have
lose
no
that
sexual
ability.
drive
Absolutely.
and have difficulty
Take my
maintaining an
left
erection.
arm. Yes.
Exactly that.
Yes.
But what men who are an Avatar need to be mindful of, and I always want people to know this, if you've been on Avanart or finasteride for more than 6 months, it artificially halves your PSA. So a PSA of 3 is actually 6. A PSA of 4 is actually 8.
So we're going to get a false sense of everything's okay.
Exactly that. And a lot of men do that. They know that when they take the Avodart, their PSA goes down.
They just want to cheat the test.
Yeah. And they don't realize that they're probably missing the opportunity to pick up early prostate
They just want the
cancer.
wife to stop nagging.
Exactly. We have a call coming in. Good evening. This is Urologist Speaks.
Yeah, good evening, Dr. Pinto.
How are you doing?
I saw you tuning in, and so I just learned that information that you gave me, right?
Yes.
But you know, I was always paying attention, and you always tell me to. At one time, I didn't even want to stop taking the Avodart because it didn't prove so great, right?
Yes.
And you explained to me how it would kill the sex drive, but it didn't kill my sex drive because, you know, I have 2 children post 52, right?
Well, you're a lucky one. You're a lucky one.
Yeah,
maybe
not financially.
Yeah, maybe it dimmed it, but you were such a glory hound that you were fine.
Yeah, but you remember the reason why you gave me the super pubic because, you know, I still wanted to have some fun.
Yes.
Yeah, and so I like how your guest, he's having humor, so I decided to join in because I get kind of jealous. He's having fun with it. And so this is what happens post, you know. And I like to share some experience. I hope Brother Line come on because this is, you know, like with me, with my diet, you know, I don't eat meat and for decades. And so I'm basically a pescatarian, like, you know, whatever, but and I still end up at BPH. So I look at this antigonadic atrophic attack that most people are denying that you admitted to with the decreased spermatozoon count. And gonads in general, whether it be female or females, right? But I mean, what I'm saying is, Doctor, I appreciate this information so much. And so, with me, what I do is, you remember you guys had to really get on top of me to even start taking the Flomax and Avodart.
Yes.
I was lying to you guys for a while, you know. And then
let me just say, yeah, we were talking about sizes.
I'm ready to eat these things because I couldn't, you know, the terp was so messy. So I just share this with your guest because I like how he's being so forthright with the disclosure. So we have to humanize these stories because it's really scary with other situations. Now I just mindful of what you said just now with the Avodart, with cheating the PSA, right? Because my PSA is in range now. So now that I'm off the Avodart, I have to come in. I really about to go do my physical. I'm supposed to go Friday, trying to get, you know, to go do these normal things. Like I do it every year, right?
Yes.
Yeah, and so I was taken aback by that, and I just actually, I'm glad you said that because I've been mindful of that because what I did and what I do anyhow is like, even though you say, like, I was taking it, the Avodart after they achieved the effect, I still would go like a month or so without taking it or 2 months and then I'll start taking it again intermittently. Is that a good idea? Because I don't.
Well, another thing that a lot of people need to realize is that even when you're on Avodart, it takes 9 months to a year to potentially reduce the size of your prostate by 40-50%, but it doesn't do anything for at least 9 months. So you gotta, for a lot of men, you're killing their sexual drive for 9 months, and they're not seeing any improvement in their urinary symptoms. You just gotta hold strong. And let's say your prostate is 150 grams. You reduce that prostate by 50%, it's still huge.
Yeah, but I want to put this in as a living experience. I don't think it did nothing to my drive, but what I found out is I was angry about the retrograde ejaculation, right? And,
it all depends. So, for example, what I do for most patients is I do an ejaculatory sparing bipolar transurethral resection. And what
sounds fun.
Yeah. So when you have 150 gram prostate, it's very difficult to do that. Yeah, and you did have a resection, and you did have 2 kids.
No, I was kind of different, but
yeah.
Like I say, but I got this joke for your guest. You remember when I was wearing the catheter, right?
Yes.
I couldn't believe how long I was wearing it, you know, and I made the joke, and I told, I think it's you or Dr. Stevens or Dr. Roberts, that I was actually jogging the bridge with this catheter on. My brother couldn't believe it. He was so laughing, but I tell him I was jogging the bridge in the steps.
You was jogging the bridge?
I got so comfortable wearing it. This is a joke for your guest.
Some people live their whole life with a catheter.
I was afraid of when they take it off because it was so easy to urinate. You know, at one time the bag burst through it. Man, there's so much nightmares anyhow. but it's good to have common sense because I had a bad experience I had on the ward where, you know, the blood clots post the surgery, and the nurse told me take 2 pills to go sleep. But me being with a thinker, well, I said this bag was at 200 milliliters for hours, man. So my bladder almost burst. So I was hoping, and I was like, I was kind of disappointed in the level of knowledge that the nurses displayed towards this condition that men have. Because they was ignoring me all through the night. I actually wanted to walk up the ward to go in the E&E to get attention, man.
Yeah,
I really and truly was scared.
Well, I'm not going to let you hit out.
Walk with that big bag, though.
I always say you have to walk in someone's shoes. I'm not going to let you hit out the nurses. The nurses are angels in disguise, and they don't get enough. They're overwhelmed. They're overwhelmed.
Listen, me really, truly, I love them, but this particular nurse, I don't think she liked men in general. That's what happened because, I mean, it was like if I was ignorant and I had to take the 2 pills and go sleep, who knows? But when they finally look in the drawer, they found out that most of the pills, the painkillers they was giving me, I was just taking them and throwing them in the drawer because I don't believe in course medication because I think about my liver so much.
All right.
Thanks. I like them to listen.
Hey, can you hold on before you go? Can you tell me?
I got to get this rebroadcast because I think I missed it on something, but I like that and give thanks.
Hey, caller. Before you go, can I ask you something?
Yes, sir.
About that jogging thing.
Yeah.
Where'd you tie it?
I had tied normal. It was
It's strapped to your leg.
So you give it like extra rope for the running?
Rope. It was just a normal strap to the tie, and they ran the short pants. And I used to make a joke, and I used to show my female friends like this is where my penis actually is. I used to point to the little blue normal thing, but they couldn't actually believe. But after Dr. Pinto decided to give me, after I came in there with one condition, it was bad more. I had the post,
I'm picturing you running with this thing, and it's
what you call it? You call it uremia?
Yes.
What you call it with the blood in the urine, Dr. Pinto?
Hematuria.
the dogs chase you?
Macroscopic hematuria. Yeah.
So it's all a human experience, but I mean, it happened to me, and I'm a vegetarian, and I have a good diet, so I don't know what really is the cause of this. We have to be under attack. Give thanks.
Yeah, so what we're here trying to give knowledge. We're trying to prevent persons from
And that's
suffering
not an unusual
needlessly.
story for you,
No.
dog.
I literally,
That people go, wow.
if I can estimate over 500, 600 men in this country are on a catheter, and they just got to change it every month. And you can imagine the indignity of
On
it.
the day to day, every
a catheter always eventually is going to leak.
Just let things go.
It's always eventually going to get infected. There's always going to be blood in the urine.
Wow.
Obviously, they can't use their male member.
Wow.
So it just reduces the quality of life. So don't get to that stage.
Whatever you can to avoid that.
Don't get to that stage. So we said a lot. I think we changed lives. I always would love to welcome you back. You're a breath of fresh air, Eddie. Thank you very much for giving your personal experience.
Hey, thanks for your professional experience. It really did. I kid you all not. It changed my life.
Yeah. So never let the bladder control your life. Never let your prostate control your life. Always control your bladder and your prostate, and never let where the next bathroom is dictate how you move throughout life. This is Urologist Speaks. We're gonna welcome back Eddie Carter, hopefully very soon again. But thank you very much, and have a good evening, Eddie, to his lovely wife and Bahamas.
Thanks, Greg.
Man, we live longer.